Okay, so today we're talking about having shoelaces untied. No, we're not. We're talking about getting better hip stability and stability in the outside of the hips, the abductors or the external rotators. So one of the things we want to sort of create is some torque in the hip, or torsion. And we're going to use a box squat to show the example. One of the things we find a lot of people who assume this sort of position when they squat, their knees come together, is that they're actually not using very much of these muscles. They're actually very tight in the calf. So that's one of the first places we go, is relax the calf, work on the outside of the hip abductors. So first thing I'm going to sort of mention is, if we can, we're going to try and push out and go with a knee outside wider than the toe. Okay? If you're finding you can't do that and you're coming in there, this would be the fix for you. So one of the first things we can do, people get really, really tight here, and you often see them with very flat feet as well. That's something else that goes with that. So if you've got flat feet and not kneed, this is probably a good fix for you. You're going to find where the tightness is in your calf. Could be in the outside, could be on the inside, could be high up. You're rolling to find the area. Once you find the area there, I'm going to actually then tack and floss that tissue. So the goal is more do some ankle movements, loosen the ankle, all right, while I'm doing that, to create sort of myofascial release. We're not really thinking about rolling over the knots, okay? We want to find the knot, pin it down. Once you've done that, that's about a good 1 minute to 2 minutes. We're going to use something in the surface. I'm going to have to come on the side here a little bit to see this one. We're going to have to try and get the foot up against a solid surface there. Make sure the knee is locked. And I'm trying to bring my hip bone closer to the wall. Not my chest. This is no good for us. All right, we're not trying to stretch the sciatic nerve here. We're trying to get a stretch in the calf and the foot. So I'm going to pull in, and then I'm going to try and get my hip closer. And actually, that's a strong stretch in my arch, sole of my foot, calf, right at the inside of my leg. Once I've held that, again, hang out there, scour, find where your ankle is stiff, find where the ranges you can't go to, about 1 to 2 minutes there. Then we're going to use a little stretch band, and we're going to work the hip abductors to get you out of that habit. So we're addressing the pattern of movement that is a squat, all right? You could do this for a lunge or a different pattern of movement, depending on what you're having pain or dysfunction with. But again, we're going to set, we're going to try and get the weight spread in the feet, knees locked, create a little bit of external rotation or abduction as well, and then my knees should naturally track out, and then back up again. Good. We'll try one more time. Feet are fairly straight. You can have 5 to 12 degrees of turnout. There, set, wide, and I'm out. Good.